Hello, I'm Sat Kelley from Heath Dental, and welcome to another episode in the series on dental implants. So just going to show how the process works and what the options are when you have the unfortunate need for a removal of an existing tooth. So here we have a model where this tooth in the middle is the one that needs removing. So the tooth is taken out. You then have a gap. Okay, now the options with the gap is either you keep the gap, providing everything else remains stable, which means the top tooth doesn't grow down into the space, the tooth behind doesn't tilt, and the tooth in front doesn't tilt. And you can function normally elsewhere. Or if you want to fill the space, then you can either have a little denture, which sometimes clips onto the tooth behind and the tooth in front. Or you can have something fixed, and a fixed, you have two options for a fixed. One is we can do a bridge. And to do a bridge, if you look, tooth behind, providing it is strong enough from the root's point of view, and the tooth in front, providing that's strong enough from a root's point of view. So if I turn that around, you'll see the roots. Multi-rooted tooth on the molar, single-rooted tooth on the tooth in front, which is the premolar. So what we need to do, we need to trim each tooth, thereby creating space for a bridge. The teeth are both scanned. The scan goes off to the lab, and the lab then makes your bridge. In the interim, you have a temporary crown on here and a temporary crown on there. The bridge comes back and is then bonded on to the tooth either side. Okay. Now, that is fixed. It's not removable. You have to clean underneath the bridge on a daily basis. And they work very, very well. The downside of these is that we do have to sacrifice some tooth tissue in order to facilitate making the bridge. So that's a bridge. If these teeth are healthy and you don't want to damage them, because obviously cutting these teeth down would reduce the life expectancy of both of these teeth, then the other option is to put an implant into the extracted socket. So what an implant is, in effect, is an artificial root. So I don't know if you can see back here, but you can see how there's nothing in here. You've got roots either side, so we need to replace the missing root. It's an artificial root made of titanium, which is placed very, very carefully into the former extraction socket. Okay, so we're just going to tighten that up. Once that's on, it's usually left to heal for a period of around 4 months. And at the end of 4 months, a scan's taken of this, and an abutment is placed. And the abutment is a little bit like a bracket. Fits into the implant, and onto which is placed a crown, like that. Okay, so this doesn't use the two teeth either side. It's self-supporting, maintains the bone underneath, because now we have an artificial root in there, and doesn't sacrifice the two teeth either side. So that dental implant, the downside of that, it takes longer than the bridge, but it gives you something that doesn't jeopardise the teeth either side. I hope that makes sense, and if you have any further questions, feel free to email me at sat.kelley@heathdental.com. That's sat, S-A-T, .kelley, K-E-L-L-E-Y, @heathdental.com. I'll see you next time. Bye for now.